So thanks for joining us today on People with Passion for Pets. I'm talking to Dr. Josh Sosnow, a veterinarian here in Scottsdale, Arizona. And today I am talking to him about a topic that is coming up more and more, and that is seizures in dogs. Good morning, Dr. Sosnow. Welcome back to People with Passion for Pets.
Thank you very much for having me.
I am so pleased to have you back on this show. Dr. Sosnow, last time you were here, we talked about things that pet owners should know in the hot summer months. We talked about heat exhaustion, rattlesnake bites, and all kinds of other topics. But today I ask you back for a very, very specific topic, and I'm excited to have your professional opinion. I hear more and more about seizures in dogs, and I don't know if it is that we're just much more connected, and so topics like these come up more, or is it really that there are more dogs that have seizures? So in your professional opinion, what do you see in your practice?
Here in the Southwest, particularly in Arizona, we have something called valley fever, which is an infection caused by a fungus that lives in the environment, and it can make its way to the brain, causing seizure activity. Now, if you had a dog that was diagnosed with seizure activity that was living in Vermont, for example, who had never traveled outside of Vermont, you wouldn't consider valley fever as a possible cause for seizure activity, but you might look at the possibility of tick-borne diseases, for example. So there's a lot of variability in terms of the way or I should say, a lot of variability in what we look for when diagnosing seizure activity, and that's going to vary depending on the patient's age, location in the country, and medical history overall.
And so just for our viewers and to clarify for me as well, so I hear oftentimes the word seizure and then I hear epilepsy. Is there a difference between the two, or?
I think perhaps the best way to clarify those terms is to say that epilepsy is a condition that produces seizure activity. I guess you could use the word disease to describe epilepsy, whereas a seizure is a consequence of something else. So it could be a consequence of epilepsy. It could be a consequence of perhaps, ingesting a toxin or an infection or, any variety of things.
Gotcha. So a seizure really is just a symptom of an underlying cause.
Correct.
Okay. And what are the signs of seizures in dogs?
Well, the most classic seizure that people think about is something that we refer to as a grand mal seizure. That's where you get, full body convulsions. Sometimes you can lose control of your bladder or bowels. They can vocalize, they sort of fall to the ground in a prone position. But admittedly, there are other types of seizures that affect one part of the body. For example, seizures might cause the eyes to flutter, or, might cause only tremors in one part of the body. Admittedly, in those situations, at times it can be difficult to recognize, especially if we don't have, say, a video of it to see. But I think it's fair to say that when people typically experience seizures for the first time, most clients see it as a grand mal seizure that involves the entire body.
So obviously that would be super scary. If I saw that in my dog, I would definitely be concerned. Is this like an emergency where when the seizure happens, I should take the dog to the vet, or is it something that I should be kind of working through and then consult my vet after the fact?
Well, I think it very much depends on whether this is the first time you experience the seizure, or whether, this is something that's happened, on a recurring basis. Certainly, if this is the first time you've ever observed seizure activity, you do want to contact your veterinarian right away. It would be preferable from our standpoint to evaluate the pet as soon as we can and begin the process of trying to identify the cause. That said, if you have a patient, say, for example, that's diagnosed with epilepsy, and you've seen seizures before, they're going to happen on occasion, it's very appropriate to, make sure your pet is in a safe space, in a place where it can't injure itself, stay with them until the seizure, resolves, and give them obviously the necessary time to recover from it before they're left alone. So it's really going to vary depending on the situation. And of course, the other thing to consider is the length of time the patient is actually seizing, because the longer a patient seizes, the more concerns we have about the possibility of any type of lingering or more long-standing damage that could occur. Obviously, when you're seizing, you have to be concerned about, for example, your body temperature. If you're patient is experiencing convulsions for a prolonged period of time, there's always the possibility that body temperature could rise. So staying with the patient, whether you're experienced in dealing with a pet with seizures or new to it, is really important. I think the other thing to consider is that if you always have questions, or whenever you have questions rather, call your veterinarian, because we're there to help you and guide you through the process. And even clients who have experience managing seizures in their pets still need additional help at times. And it may be a situation where we as veterinarians need to consider modifying our treatment to decrease both the frequency and severity of the seizures that your pet is experiencing.
Now, I know one of the things that I hear a lot about people and seizures is that you're supposed to be sure that they don't swallow their tongue. Is that something you would want to do as a pet owner?
As a general rule, it's not something we really warn people about. Actually, with respect to the mouth, the thing that we really tell people to do is keep your hands away from the head or mouth, because in the process of having convulsions, your pet could inadvertently bite you. Not with any type of intent, but you're sort of in the line of fire, if you will, and you could get bit and potentially seriously injured. So it's best not to put your hands near your head or face. And if you do need to, for whatever reason, restrain the pet because they're convulsing and they're at risk for harming themselves, ideally getting that pet on the floor so they can't fall off a piece of furniture or a bed, for example. And even using a towel and using the towel and your arm to place a little bit of pressure on the neck so they can't sort of turn and bite is not an unreasonable thing to consider.
Gotcha. What are some of the treatments or tests that you would generally do when somebody comes to you and the pet had a seizure for the very first time?
So the standard testing that we do, regardless of, say, where you are in the country, usually involves basic tests like a CBC or a complete blood count, looking at red and white cells, some sort of chemistry panel to look at or look for evidence of organ dysfunction that could cause the seizure activity, as well as an analysis of the urine. Beyond that, certainly there are tests that we do looking for certain types of infectious diseases, again, depending on where you are in the country, which could cause seizure activity. And beyond that, certainly, one at times could consider things like ultrasounds, x-rays, or even more advanced imaging like an MRI, for example, if you really have concerns about the possibility of changes in the brain that could be leading to the seizure activity. Again, some of the testing you're going to do really is dependent on the age of the patient. Again, because we're looking for different possible explanations for the seizure activity, as well as where you're located geographically and whether there are concerns about infectious diseases. So there is some variability there, and we usually go through a stepwise process, working our way through, from the most likely causes to some of the lesser, least likely.
And then what is some of the treatment? In my research, I kind of came across, they said that there really isn't any cure, so to speak. You basically are going to be treating this type of condition on almost like for the life of the pet. Is that correct?
Well, in cases where the seizure activity is brought on by, let's say, an infectious disease or perhaps by a condition affecting another organ system, it probably is fair to say that there are certain treatments that could basically eliminate the possibility of seizures going forward. Certainly for patients who have, say, epilepsy, which is probably one of the most common conditions to produce seizure activity, we don't have treatments. We can't cure it. We manage it with a variety of medications, much as they do on the human side. Now, these days, unlike our experience even 10, 15 years ago, many of the drugs that we use to manage seizure activity are human drugs, and they're very safe and have relatively few side effects. So, they can be on these medications long-term without risking damage to other organ systems. But even things these days like CBD, which can be used to augment the treatment necessary to control seizure activity. I think it's actually important to mention that when I talk to owners about a new diagnosis, say a new diagnosis of epilepsy, it's important to realize that the purpose of medication is really to decrease the frequency and severity of seizures. But it is possible that even a very well-controlled dog still could have a breakthrough seizure now and again. And certainly when we talk about observed seizure activity, it's just that. We're talking about seizures that you actually observe or see evidence of, because it is certainly possible that, when you're not at home, your pet could have a seizure and you're unaware of it.
Is there anything like when it comes to preventative things that we could do?
On occasion, you'll encounter an owner who says, I see this behavior, or when I see my patient begin to vocalize in a certain way, it's a tip off to me that a seizure may be coming. But to be perfectly honest, most of the time owners don't have any advance notice, and there's nothing that we can provide them, unfortunately, that gives them a heads up as to when a seizure might occur or how severe it might end up being.
And maybe just one more time to go back to, you said the most common cause of seizure is epilepsy. Is that like a genetic thing, or do we know what causes it?
So we take our cues certainly from the human side, and there have been a lot of studies that have identified certain abnormalities within cells in the brain, abnormalities with respect to what are called ion channels or certain receptors that are the cause of seizure activity. And certainly, our brains are very similar to the brains of dogs and cats, and we have to believe that if these abnormalities exist on the human side, to some degree, they probably exist on the veterinary side. So yes, in a lot of patients, there probably is a strong genetic predisposition. There is you're essentially born with this. That said, obviously, there are certain conditions that can develop over time. I don't want to necessarily say are genetically based, but at some level probably are. But again, they're emergent rather than things that are very early in life that can be responsible for seizure activity. And at the end of the day, as medicine has progressed, certainly like over the last 20 years, we do recognize that so much of what we deal with probably has some sort of genetic basis.
What are the percentages of dogs that have seizures?
That can be a difficult question to answer. I think that, seizures are not unusual. And certainly we do see circumstances or patients where a seizure occurs once and may never occur again. For us as veterinarians, it's not uncommon to see a patient with seizure activity. It's certainly not uncommon to see a young patient who comes in having seized for the first time and for us to eventually, make a diagnosis of epilepsy. And so this is not as unusual as people might think. Now, one of the things I try to communicate to folks is that this is very manageable. This is very livable. This doesn't have to compromise quality of life. It doesn't mean that your pet or your relationship with your pet has to be any different. You and your pet can have a perfectly normal relationship, and you can do all the things you want with them. And yeah, they're on medication, but that's okay. I mean, it's very manageable. And one of the new things that people ask me a lot about these days is how can CBD be used to manage seizure activity? Now, several years ago, the FDA approved a CBD-based drug for use in children with certain rare seizure disorders. And there's actually a study in veterinary medicine that has evaluated the use of CBD along with other anticonvulsants to manage seizure activity. And more and more people are looking for that as an option because, they consider it a more natural option. Certainly, it's becoming more of an option for a lot of folks. And, in my practice, certainly we use a fair amount of it. I would say usually, again, as an adjunct to other medications, but owners do appreciate the benefits they get from it without the risks that can sometimes be associated with more traditional anti-seizure.
Sometimes it's difficult to try and figure out what the proper dosage should be, right? So right. Can you speak with that a little bit?
So that's one of the biggest problems that we encounter when we see a lot of companies advertising their CBD product can be used to help manage seizure activity. In a published study, which came out of Colorado State, they used a very specific dose, actually about 2.5 milligrams per kilogram given twice a day. That said, if we take our cues from the human side, we recognize that the dose that's actually needed to help manage seizure activity with CBD may actually be quite a bit higher. And, so sometimes we have to go through this escalating trial to find what works best for each individual patient. Until we have more published studies, I don't know that it would be appropriate to say that there's a firm or set range over which you would consider dosing CBD to help manage seizure activity. That's why working with your veterinarian is important. That said, when we look at the experience on the human side, some of the doses, go as high as 10 or even 20 milligrams per kilograms.
I know that from talking to you before, it's still something a little bit new, not as new as it was just maybe a year or 2 years ago, but still very new in veterinary medicine to use CBD. And that's why I think you are definitely also one to, be there to educate pet owners, but also veterinarians in the use of CBD. Is that correct?
Yeah, I mean, ultimately, we don't learn, even as of today, students don't learn anything about the endocannabinoid system, which is an increasingly important system in how our body regulates itself. And, we're beginning to recognize that certain deficiencies or abnormalities can lead to a whole variety of conditions. As a consequence, because it's a new science, we have to get educated on it because, like it or not, the cannabinoids, the phytocannabinoids, those that are derived from plants, are here to stay and will likely increasingly take on a more important role with respect to how we manage a whole variety of conditions. So as a consequence, we as veterinarians who are tasked with providing, guidance and medical care for our pets really need to take it upon ourselves to learn as much as we can, because our clients are already asking about how they can use these types of products. And many of them are using them without guidance. So we're really sort of need to be in a position to give them the best advice possible, depending on the conditions.
Just circling back when it comes to seizures, don't self-medicate your pet. Make always sure that you closely work with your veterinarian first to make sure that you got the proper dosage and proper combination.
That's correct, because the cause of the seizure activity can be quite serious. And until we determine the cause, it's the patient is at risk. So we really, want to use all the tools that we have at our disposal to try to get to the bottom of the question as to what's causing the seizure activity, so we can not only determine how best to treat it, but minimize the risk to the patient's quality of life overall.
Great. Well, thank you so much. I think you answered all of my questions until you can maybe, I don't know if you have anything else to add to the subject matter.
No, I just want to thank you guys for having me on today. And, like I said, seizures are not the be all end all, and they're very manageable. Seizure disorders are, again, not uncommon, but, we're here as veterinarians to make the quality of your pet's life and the quality of relationship as good as possible. So use us when necessary.
Yes, thank you for that. And again, thank you for being on the show. We really enjoy your expertise here. Thanks so much for joining us on People with Passion for Pets. If you enjoyed this interview, then you might also like a lot of our other interviews. So check out my playlist over here for the second season of People with Passion for Pets. And until next time, keep your paws on the road.